Our next speaker is going to be Dr. Salma Eraky from Mansoura University in Egypt, who will be discussing the effects of omega-3 fatty acids and pioglitazone combination on insulin resistance through fibroblast growth factor 21 in type 2 diabetes mellitus. Salma, we can see you there. If you have your screen to share, you can feel free to do that when you're ready.
You can see it now?
Yeah, we can see your screen. If you just want to make your slides full screen, okay, that would be great.
Hello, everybody. I'm going to talk about the effects of omega-3 fatty acid and bioglitazone combination on insulin resistance through fibroblast growth factor 21 in type 2 diabetes. Of course, diabetes is a chronic and metabolic disease characterized by elevated blood glucose levels, which lead to serious complications to heart, blood vessels, eyes, kidneys, and nerves. 422 million people over the world suffer from diabetes, which is one of the leading causes of death in the world. Especially type 2 diabetes accounts for 90 to 95% of diabetes cases. It's characterized by glucose intolerance, compensatory hyperinsulinemia, insulin resistance, and impaired beta cell function. Type 2 diabetes is largely caused by social and lifestyle factors, such as lack of exercise, unhealthy diet, and overweight. So, a medical approach is not always sufficient for type 2 diabetes management. That's why in our study, we were motivated to use omega-3 fatty acids as a natural product, which have a variety of anti-inflammatory and lipid-lowering effects. These effects are mediated through interaction with PAPAR alpha, suggesting a possible beneficial effect in the management of type 2 diabetes and its complications. The most common omega-3 fatty acids are docosahexaenoic acid and eicosapentaenoic acids that are widely distributed in fish oil. Eicosapentaenoic acid and docosahexaenoic acid possess anti-inflammatory effects through formation of anti-inflammatory mediators such as D-series protectins and E-series resolvins, and also formation of low pro-inflammatory potential mediators such as 5-series leukotrienes and 3-series prostanoids. Also, inhibition of the inflammatory arachidonic acid metabolites such as diene, prostanoid, and tetraene leukotriene. Okay. While bioglitazone is a commercially available drug which belongs to thiazolidinedione class of anti-diabetic drug that improve insulin sensitivity, lipid metabolism, and glucose homeostasis through activation of PAPAR gamma. Fibroblast growth factors are classified into intracrine, paracrine, and endocrine fibroblast growth factors. Of them, we were interested in fibroblast growth factor 21, which is one of the endocrine fibroblast growth factors. Fibroblast growth factor 21 function were completely unknown until 2005, where it was proposed to be a novel metabolic regulator and potential anti-diabetic drug. It's expressed in several tissues. As we can see here, it's expressed in the pancreas, in white and brown adipose tissue, in the liver, muscle, and heart, having several effects such as controlling glucose, decreasing glucose uptake, and increasing free fatty acid turnover. The regulation of fibroblast growth factor 21 is highly complicated, and in 2007, Badman and Inagaki showed a crosstalk between fibroblast growth factor 21 and PAPAR alpha signaling in the liver during during fasting, and that's why we used omega-3 fatty acid, which is a PAPAR alpha agonist. Also, PAPAR gamma activation increases fibroblast growth factor 21 production in adipose tissue, improving insulin action. And that's why we use bioglitazone as a PAPAR gamma agonist. The aim of the work is to investigate the role of oxidative stress and fibroblast growth factor 21 in the pathophysiology of type 2 diabetes, and to investigate the potential anti-diabetic effects of combining natural compounds as omega-3 fatty acid, which is the PAPAR alpha agonist, with bioglitazone as PAPAR gamma agonist in a model of type 2 diabetes, and to understand their molecular mechanism through fibroblast growth factor 21. In this study, rats were randomized into control group, diabetic group, omega-3, bioglitazone, and combination groups. Normal group received the standard diet for 4 weeks, then received a single dose of citrate buffer along with standard diet, which was continued until the last of the study. Diabetes was induced by feeding rats high-fat diet for 4 weeks, followed by injection with low-dose streptozotocin, along with high-fat diet, which was continued until the end of the study. Omega-3 fatty acids group received omega-3 fatty acid at a dose of 10% of diet. Bioglitazone received 20 milligram per kilogram bioglitazone, and combination group received both omega-3 and bioglitazone by the same doses. At the end of the study, rats were fasted, blood was collected and used for measurement of blood glucose and for preparation of serum, which were used for measurement of serum fibroblast growth factor 21 by ELISA technique, and serum triglyceride and total cholesterol levels by spectrophotometry. Then rats were sacrificed, liver was collected, and part of the liver was immersed in liquid nitrogen for further real-time PCR analysis of fibroblast growth factor 21 for gene expression, and part was used for spectrophotometric assay of MDA, malondialdehyde, and ELISA assay of FGF21. The results, a diabetic group showed significant increase in fasting blood glucose level that was significantly decreased by all treatments, but only bioglitazone and combination group were able to normalize the fasting blood glucose level. Then, homeostasis model of insulin resistance was calculated using fasting blood glucose level and fasting insulin level, and it was significantly increased in diabetic group, indicating a state of insulin resistance, and it was significantly decreased only by bioglitazone and combination groups. Then serum triglyceride and total cholesterol levels were significantly increased in diabetic group, and they were significantly decreased by all treatments. Hepatic malondialdehyde level was significantly increased in diabetic group, indicating a state of lipid peroxidation and oxidative stress, and all the treatments show antioxidant effect by significantly increasing hepatic malondialdehyde levels. For serum fibroblast growth factor 21, it was significantly increased in diabetic group and significantly decreased by all treatments in comparison to the diabetic group. For hepatic fibroblast growth factor 21, that was measured at protein level by ELISA technique and at gene level by PCR technique, it was significantly decreased in diabetic group, and it was significantly increased by bioglitazone group. At protein level, it was significantly decreased by omega-3 and combination group in comparison with diabetic group. The discrepancy between hepatic levels and serum levels may be due to the contribution of other tissues to fibroblast growth factor 21, such as adipose tissue and heart and so on. Correlation studies were conducted showing significant positive correlation between serum fibroblast growth factor 21 with both blood glucose and HOMA-IR. From this, we can conclude that type 2 diabetes increase serum fibroblast growth factor 21, leading to a state of oxidative stress, dyslipidemia, insulin resistance, and hyperglycemia. These were significantly decreased by bioglitazone and omega-3 combination. Also, the single treatment with omega-3 and bioglitazone were able to decrease serum fibroblast growth factor 21, oxidative stress, lipid profile, and the blood glucose, while HUMA-IR was significantly decreased only by bioglitazone and combination treatment. So combining PAPAR alpha agonists such as omega-3 fatty acid with PAPAR gamma agonists such as bioglitazone showed potential effects in lowering blood glucose level and improving lipid profile and insulin resistance through modulation of fibroblast growth factor 21 and inhibition of lipid peroxidation. We recommend to conduct clinical studies to evaluate the potential effects of combining omega-3 fatty acids with bioglitazone and with other anti-diabetic drugs in patients with type 2 diabetes. These are the references. Thank you.
Amazing. Thank you so much. That was a really great talk. I'll open up the floor for questions again. I think I see one here in the chat. So what is the advantage of using omega-3 fatty acids when compared to other treatments for type 2 diabetes mellitus?
It can be used as a single treatment, but it can be used in combination with other drugs, with other anti-diabetic drugs, decreasing the or improving the lipid profile and the dyslipidemia. And the advantage of it is that it is a natural drug, not chemicals.
Amazing. Thank you so much.
It will be with lower side effects. Thank you.
Perfect. Thank you. I do have another question here. So can diabetes type 2 be considered hereditary?
Yes, it's hereditary.
Amazing.
More than type 1 diabetes.
Great.
The genetic factor is more in type 2 diabetes.
Thanks very much. And I do have one more question here. How do you measure oxidative stress? To my understanding, I expected measure of antioxidants such as SOD, GSH, among others.
By measuring malondialdehyde, MDA.
Perfect.
Using spectrophotometric in the liver.
Great, thank you very much. And one more question, actually. Can you still reap the benefits if you eat fish or foods with omega-3 instead of pills?
Fish or omega-3 as pills?
Instead of eating pills, if you have an omega-3 high diet, it sounds like this individual's asking, would you still benefit?
Of course, it will be beneficial, especially oily fishes.
Perfect. Thank you very much. That was an amazing presentation. The Q&A will be open, and if there's anything that comes through for you, that is where you can answer them.
Okay, thank you.
Thank you again.
Thank you.